here with you again this week. Last week talked a little bit about x-rays and ultrasounds. X-rays use radiation to penetrate your tissues. Different tissues absorb different amounts of radiation, so that's why you get the different colors. And it's really good for looking at bones and hard surfaces such as teeth and things like that. And we talked a little bit about ultrasound, which is a sound wave that goes in. Different tissues absorb the sound waves and bounce it back at different amounts. It's really good for looking at your organs or soft tissues like muscles, ligaments, and tendons and things like that. But there's a limit to what an X-ray and an ultrasound can see. They're really only good to see 60 to 75% of something that's there. So now we have something called CAT scans and MRIs that we can use. A CT scan or CAT scan stands for computerized tomography. It uses a radiation. It kind of goes a circle around you. You're in a tunnel. Kind of goes around you and takes many different pictures. Then the computer puts these pictures together to come up with a 3D image of what's going on inside of you. The one thing with a CT scan or a CAT scan is it's very quick. It only takes about 5 to 10 minutes to get a good image. So it's very useful and when trying to see something that you want to treat very quickly. So if somebody has a brain aneurysm, some sort of trauma to their insides or their head, you want to get treatment on it very quickly. So it's really good for things like that. It's just not quite as clear as something that an MRI would show. The other thing with a CAT scan is it is lots of radiation. So it's very harmful to you. They say 1 in 2,000 people may get some sort of free radicals from having a CAT scan that can later lead to some type of cancer. Also, with a CAT scan, sometimes they have to give you a radioactive dye or some sort of dye to see the tissues a little better. Some people may have a sensitivity or allergy to this, which they'll react to. An MRI stands for magnetic resonance imaging. Very similar. You're in a tube, and you're holding the tube. So if you're claustrophobic, it's not a good thing for you. But it takes about 30 to 60 minutes to get a good MRI done. So it takes a lot longer, but it gives you a much clearer image as to what's going on inside and what they're looking at. MRI can be very loud. They often give you earplugs to drown out some of the noise. They also give you a radioactive dye so that sometimes you may have an allergy or sensitivity to that dye. MRI gives very clear pictures. The problem with it is that if you have any metal in you at all, so people with a new hip or a new knee, prosthetic, any surgical clips inside them, stents, things like that, can't have an MRI because the magnets will pull that metal out of you, and that wouldn't be very good. When you're going for a CAT scan and MRI, a CAT scan will cost you anywhere between, if you want to pay for it privately, between $450 and possibly $1,500, whereas a MRI is more expensive. You're looking between maybe $750 and $5,000, depending on what they're taking it up. In Ontario, we have certain parameters we use to move on to getting an MRI and a CAT scan because they're more expensive and time-consuming. So things such as how long you've had your problem for, does it radiate anywhere, are you getting any night pains and night sweats, how long have you had it for, and what have you done for it, has any treatment started to make it better. If some of these answers to this is yes, then your doctor may think about sending you out for a CT scan or an MRI. Anyways, if you have any questions or anything we talked about here today about CAT scans and MRIs or ultrasounds or x-rays, you can always talk to me via Facebook, or you can contact me at jgoldsworth@goldswells.com. I'm Dr. Jeff, and I've got your back.